Gentlemen, thanks for your service, what you're doing. You do a lot of work behind the scenes that Americans don't have the opportunity to be able to say thank you. So from the people of Oklahoma, let me pass on my thanks because you've done quite a bit to be able to serve the folks in my state and across the country. Let's talk a little bit about this national stockpile, though. There was a lot of early engagement on expired N95 masks and expired prescriptions and such in the national stockpile. Help me understand how we got to that point that things were expired, and how does it get better to be able to deal with the rotation so that we don't have expired materials in the future?
Yes, sir, Senator. I'm going to refrain from talking previous to March 19th, right? So I can't speak to those practices, but I will talk to you about what we're doing going forward. This national stockpile shouldn't be thought about as I buy it, I put it on a shelf, and I'm done. Working with the colleagues at Health and Human Services, I'm trying to develop a national stockpile next that uses practices that DoD has done, has used. DoD has a War Stopper program where we buy inventory, we put it on the shelf with our commercial partners, and as the commercial partners make issues, they replenish and they manage shelf life for us. That's just one example. And so we're looking to change from a stagnant mentality of buy it, put it on the shelf, and then have to figure out how to rotate stock. It's not just N95 masks, even simple things like needles and syringes that are sterilized and wrapped. They all have a shelf life based on the sterilization. So there's work to do there going forward, and it's going to change. It's going to take a little bit of.
Do you need legislation to do that at this point, or you have the authorities you need to be able to do it right now?
So I believe Health and Human Services has the authorities, but it may take a difference in understanding of funding resources for them. And I won't be able to speak specifically for Health and Human Services, but I think they're going to need an annual appropriation that pays for a different inventory management practices than they've had. You can't just put it on the shelf and then walk away from it.
Right. Well, we'll look forward to getting a chance to be able to walk through that, because obviously if we buy a product and it sits on the shelf for a period of time and then it starts to get near expiration, it'd be much better to be able to sell that and to be able to get it off, or to be able to rotate it out and be able to keep that moving. I get what you're talking about with the DoD process and what they do in storing it with commercial entities as well. Are we at a point right now that if we had a vaccine, let's say in November, that we'd have enough syringes in distribution to be able to get it out?
So to answer that specifically, we're on a glide path to have approximately 400 million needles and syringes by I'll say December. I don't have the numbers right in front of me, but it's at least 400 million as we get into the winter, and 700 and some odd million as we get into next year.
Okay. Administrator Gaynor, let me ask you about this. FEMA is all about mitigation, storm mitigation, trying to prepare ahead of time and be able to get communities prepared ahead of time. Have you started a list right now with what we can do to be able to help hospitals, states, local entities for how they can prepare for the pandemic? Because it wasn't just the federal government that was caught flat-footed on this. A lot of hospitals and local entities had a 2 or 3 day supply of PPE, knowing they could just reorder if they needed more, but no one could just reorder at that point. So everyone across the country was caught flat-footed in this. Have y'all started a process already to brainstorm what we can do to be able to help prepare local entities in mitigation efforts?
Yes, sir. It's a great question, and I'm going to start with the way this whole system works. And when it works the best, everyone is involved. So locally executed, state managed, federally supported, to include our citizens across the country. We're probably going to have to readjust some grants. We put out about $2.4 billion in preparedness grants. Over the past couple of years, we focused on cyber and terrorism and things like that. So maybe it's time to refocus what really is important, or what we have learned from the past 120 days, what we have learned from that, and how we're going to correct it so we don't fall into the same trap ahead. So again, Everyone needs to embrace preparedness from the local, state, and federal level to include hospitals and everyone else. I think we need to embrace preservation of PPE. There were moments over the past 90 days where it was dim when it came to having enough PPE. So we need to think about how we use PPE in a new way. So I think, we're all very, we like cheap 70-cent masks from China. Disposable, throw it away one time and keeps everybody happy. Maybe that's not the way we need to go forward. Again, the majority of PPE is not manufactured in the United States. I know we have a great effort to bring that back home, but we really need to change the culture about what really is important and make sure everyone is invested in all these things. So again, everyone needs to, if you're a hospital, well, maybe you need to think about how you're going to manage your PPE and how you're going to manage surge and how you're going to make sure that it stays fresh over time. I think everyone owns a piece of this puzzle, just not the federal government.
That's great. Let me make a couple of comments, if I can, on this as well, and I'll do a quick question on it. One is, we have got to relook again. It's something this committee can continue to work on, and I thank you, Mr. Chairman, for this committee work on this area, but dealing with domestic manufacturing. All of the things that we had to get with an air bridge to be able to ship over in a moment of pandemic, I would suggest every one of those supplies we should re-examine what is our domestic manufacturing for those supplies, that we were in such a desperate moment that we had to be able to move those things via an air bridge from Asia. Why aren't we producing those domestically, and what can we do to create more domestic supply on those so that we can ramp up working nights and weekends rather than ramping up and to be able to move them over from Asia in a point where we're exposed on this. I do want to ask one more question, though, on VA. Current VA process for testing in particular. HHS makes a decision on what the need is across the VA. That gets to FEMA. FEMA then gets those supplies onto national VA and gets down to hospitals. My numbers, if they are correct on it, about 300 testing units are getting to hospitals or most entities across the country, somewhere on average of that a month. The hospitals in my state are looking for about 700 tests a week to be able to test more people coming in and to be able to help evaluate that. How do we bump up the numbers that are available to VA as we've got a complicated process where HHS decides, FEMA distributes, it gets down to VA, then VA distributes down to the individual hospitals and clinics?
So thank you for that question, and it's good to shed some light on that. Dr. Stone, who is the chief executive of the Veterans Health Administration, I talk regularly. The VA makes a request and we fulfill it. That's just that clear. If they need 100,000 swabs, we give them 100,000 swabs. We've had to tie them over with Abbott ID Now rapid testing machines, the Cepheid cartridges in order to build up their, so quite simply, for the VA and for the DOD, if they've asked for anything, we've supplied it to them. Now, how the VA distributes that within their system is kind of behind the curtain to me, but we supply nationally to the VA, and we've made sure to take care of our veterans because a lot of them are in the vulnerable age groups, as you know. They're comorbid and they're elderly, and I will look specifically into Oklahoma, but at that level, the VA gets what they need.
Go ahead.
And so I just, in addition to that, the VA has a dedicated liaison officer at FEMA full-time. And so if there's a requirement, a request, a problem, we hear that directly, all three of us, and take immediate action. So they're on the inside of this process, and again, we take immediate action on anything that we see.
That's great. Thanks. We'll try to follow up from there. Thank you.